Doing Alex Watson, Orthopaedic Consultancy. So you've strained your ankle, you don't know what to do. So I'm going to go and talk through what you should do. You've gone out, you've gone over on your ankle, and you're in a lot of pain, and you don't know what to do, and you don't know where to go. So what we're going to do is going to go through some simple steps you can do to help yourself in this time when your ankle is in a lot of pain and you're not sure the best way to do it, what to do, and how to help yourself. So I'm Alex Watson, Orthopaedic Consultancy. I'm the clinical director here. I've been working here 20 years. I've had some fantastic patients over the years, and people make some really simple mistakes. So we've asked patients to message in any questions, which is one of them is like kind of this patient's gone over on their ankles quite a lot and realised actually each time they've done it, they've had self-care better and said it's a really important thing, I wish I'd have done this better first time. So often the injury is an inversion injury, so this is it strains the outside of the ligaments here. And what happens is your ankle rolls over on an uneven surface quite often and strains these lateral collateral ligaments. There's a fan of muscles here on the outside of the ankle, and they keep the ankle stable. Now they can get damaged, they can be slightly torn or actually completely avulsed, and they can take a piece of bone. You don't know at this stage what's going on, you just know you're in a lot of pain and you're not sure what to do. So first thing to do is be careful about how much time you're going to be walking on it. So you need to try and get some weight off it as quickly as possible, see how it's feeling. If it's appropriate, take the right medication, some painkillers, ibuprofen and paracetamol, see how it feels. If you can like tap the area to see kind of if you tap it and it feels like it's really sharp, it's probably going to be quite painful. If it makes you feel nauseous, that might be a sign it's something slightly more serious where you've avulsed a bit of bone. If it's obviously the bone sticking through the skin, then obviously straight to A&E. If it's making you feel a sort of slightly sick and nauseous in sensation, that can be a sign that's a bit more serious. Then I'd be advising to speak to us immediately, or a GP, or to A&E if you really think it's that bad. If it starts to swell up, it's most likely going to swell up fairly quickly. So what you need to do is work on your sort of decide what you can do with the swelling. So when you're going to get that swelling in your ankle, you need to use the right amount of help. So a packet of peas would do really well. So packet of peas, and wrap that in a towel or a kitchen towel, and make sure it's wet. If you wet the towel, it means it transmits the cold onto the area. So if that's the case for any injury that starts to swell, you need to put a damp towel around it, or allow it to transmit the cold from the peas into your ankle. Now often people sit there quite comfortable with a dry a cloth round and they don't feel it too bad, but as soon as you put that wet round, it will transmit the cold into the swelled area really well. Now you don't want to use too much ice, because actually that can cause a kind of reverse and the body can start swelling even more. So just try and do it for about 9-10 minutes, and then afterwards you're going to leave it a period of time to allow that area to return to normal temperature. What you don't want to do is ice it too quickly or too often. So once you return to normal temperature, you need to ice again 9-10 minutes, and you can do that 3 or 4 times through that day while taking the painkillers. And then you need to gently start to mobilize it. So if you're sitting, what you need to be doing is just with your leg just nice and comfortably, make sure your leg's nice and comfortable, and just gently starting to move your leg, move your toes up and down, up and down, and it's just allowing you to mobilize that ankle, to get it more mobile, to stop it starting to seize up. What happens is the swelling builds up in the joint, and that can really cause it to jam up. So start to gently mobilize it. Now, if you're feeling sick and nauseous again as you start to mobilise it in the first sort of few hours or within a day, then you should probably again seek help, give us a call, or GP or A&E if you're worried. So you're going to mobilise it, and the second one is just start to rotate it clockwise, anti-clockwise, and do that little and often. It's not about doing a load in one go, you just need to get it mobile. What you don't want to do is spend a long period of time sitting with your foot down on the ground, because the swelling will build up in the ankle. So if your foot's down low all the time, then the swelling will build up. The higher you keep your foot, then the easier it becomes. So when you're doing it, make sure you keep it elevated as much as you can, and that will keep it nice and from the swelling to stop getting irritated, and that swelling to stop building all the time. Once you've kind of got past that period of time, it's first 48, 72 hours, so you need to keep going with the anti-inflammatories. You can use some gel locally, either or you can then, and you're using the ice. If you want to help a little bit more, you can put some heat in the calf, but do not put any heat anywhere near the calf itself. Heat in the calf will just loosen the calf muscle, make you feel a bit more comfortable. The muscles around the leg will start to tighten, and they're tightening to protect the area, and they're just bracing the area, look kind of like a scaffolding for when you're repairing a building or building a building. They will stabilise the area while some scar tissue and healing can occur. And what we need to do is encourage good function and mobility while that scar tissue gets laid down nice lines of force and actually allows the area to heal properly, not it completely immobilised and the scar tissue stops the joint moving properly. So that's the importance of the mobility, and make sure you carry on doing that anti-inflammatory effect of the anti-inflammatories plus the ice. Keep that going for the next 3 to 4 days until the swelling in the ankle goes right down. Now if it's more severe, you'll start to see some bruising coming up on the outside of the foot, and that'll be along the edge of the foot where this white area of my trainer is, and you can get some bruising. That shows that there's been a bit more damage if some bruising occurs down the edge of the foot and around the ankle itself, and sometimes it can track up the leg as well. That's again a bit more serious. It's highly likely at this stage, if the swelling is continuing, that you're going to need our help. So you should be jumping on early doors to book and work out that you need some help and treatment. Check, and you'll be watching this video for hints and tips on what you should be doing, and so that will allow you to get the early movement and calm it down. Now, once we examine it and make sure it's safe, what we do is generally progress into some working into the local muscles. So what we would do is we would loosen up the side of the muscle here, the perineal muscles, and they stabilise the lateral ankle. And what we do is we loosen those muscles to allow you to feel more comfortable. So what we can do is we can do that as well if you've got a chronic ankle that's not resolved. So we can use a foam roller. So to reproduce that, so in this position you can just lean on the side of the leg here and put pressure on it so you can loosen the side of the leg up here, and you're going to just use that running down the side of the leg, and that will just loosen that lateral leg up. That will calm this muscle that's going to go into spasm to stabilise it. We don't want to work on this area too much and make it too unstable, because that will mean that the ankle joint is more likely to go over. But you just need to do enough to loosen it to make it feel more comfortable, so you can start to walk and feel a bit easier. You can use the foam roller again to work on the calf. So again, I'm going to show you on the left one here. Into the calf here, put some pressure on it and stretch and mobilise the ankle at the same time, and you're going to work down. Again, each spot loosening off. And you're going to be doing this after a few days. You don't want to be doing it too early. You want to do it after 3 or 4 days when the majority of the swelling in the ankle settle down. So you don't want to be doing this kind of too early and pushing your ankle where you'll make it unstable. Now, as you start to mobilise the ankle like that, the ligaments are more likely to be vulnerable to injury at this stage because the ligaments are damaged. So you need to kind of get some general mobility stretches done as well, so we can stretch the calves out. So we would do this as part of our treatment plan. At no stage have I understood why the ankle's damaged, because you could have just hit a rabbit hole or a funny ankle, but sometimes you go over on your ankle because you've got a problem on the other side and it makes the ankle more vulnerable. Now, if you're a person that's gone over on that ankle multiple times, it's highly likely there's a cause for that. Either it is chronically unstable and you've never rehabilitated properly, again, drop us a line, or you've got problems on the opposite hip, knee or ankle that's making you weight bear on that side too much, which makes you go over on the ankle more likely. So you need to kind of understand why you have the problem. So for the purposes of today, we're just going to go on and say we're just going to treat the local mechanics. So then I would then recommend some stretching exercises. So some foam roller on the side and the back of the leg and the shin as well, which is a similar exercise I've shown before. And then the other one would be a stretch where you're going to stretch out the calf muscle. So we'd do this on a step normally, and so we're going to be upright and just bend your knee, stand on, and drop your heel down. And you feel a really strong stretch on the back of the calf. You're going to hold and improve that for 15 seconds. And 3 times. Now, because you have got one side, you want to make sure you keep the other side nice and loose as well. Otherwise, you allow that muscle to tighten up and take all the extra pressure. So what we don't want to do is let one side get overworked because you've got damage on the other side, because you can end up hurting the opposite side. So stretching both calves is really important. So to recap, you've twisted your ankle, an eversion injury, you've you've caused an injury to the outside of your ankle, and those ligaments have been damaged. You're confident there's no serious problems. You're going to take some painkillers, ibuprofen and paracetamol, gently getting it mobile. You're going to ice it for 9-10 minutes about 3 times a day, and do that for about 72 hours. Then you're going to start doing some gentle work to inhibit and mobilise the area with some inhibition work, and then you're going to start stretching it. The stretching would be 15 seconds, 3 times a day. If there's any severe bruising, what you can use is something called a physio creme, which is a really good cream that's good for bruising. It's a nice mixture. It's a purple tube. Fantastic stuff for bruising. It will help the healing process speed up even more. Now, if you find yourself with a chronic ankle that's not resolving, a bit puffy, it's highly likely you're probably overusing it, or you haven't rehabilitated it properly, so you do need to seek help why that is. But if you're in those chronic ankle problems, what I often recommend to do is to do contrast bathing, cold, hot, cold, hot, cold, basically 9 minutes alternating a minute each, and that will just help stir the area up to try and improve some fluid mechanics to help it heal a bit more, and you should be doing that for 3 or 4 days running. So those are some hints and tips on ankles. They are a very common injury. Chronic ankle problems that don't resolve are a very common thing in the clinic, and you know, we're all very, very good and very versatile at helping them, but you need to understand why it's happening, and you need to make sure you help yourself in the future. I'm loving these. So hopefully we're going to have some questions next week. I did have one this week on what do we do. I'll do that next week. I'm loving doing this question. So if you have any questions for next week, then just pop them in the message comments below. Just say, yeah, what do I do if I've had this, or what if I've got about this injury? What would you recommend? And that way I can talk you through next week. I'm loving doing these. I hope you guys are enjoying it too. Patients are coming in all the time saying, I've been following your hints and tips on Facebook, so I hope you're loving it like I am. If you have any questions, then give us a call or drop us a comment or follow us on Facebook and YouTube. I'm loving doing these. Any questions, give us a call. Otherwise, we'll see you again next week with Alex live at 5. Take care, guys. Bye-bye.